Hello again. Hopefully we're all back in the virtual room. Our next speaker is Datin Dr. Sri Latha Balakrishnan. Dr. Sri Latha is a consultant trauma and emergency physician and the emergency unit head of infectious disease control in Hospital Putrajaya, a government hospital in Malaysia. She obtained a bachelor's degree of medicine and surgery from the first batch of Malacca Manipal Medicine College in 2003. After completing housemanship in University Malaya, he single-handedly managed a remote clinic in Selangor, providing public health services for 4 years. Subsequently, she pursued further into the emergency medicine master's program in University Malaya and has been practicing since 2014. Simultaneously, she completed her certification in clinical hypnosis, a diploma in clinical hypnotherapy, and advanced diploma in medical clinical hypnotherapy. She has been providing therapy to help her emergency department staffs to cope better in providing quality healthcare, as well as addressing personal issues whenever time permits. To create awareness among the emergency medicine, traditional, and complementary medicine fraternity, she has presented some emergency medicine cases that employed hypnotherapy. Her talk is titled, Looking After the Frontliners, Preventing Stress and Burnout. Again, if you have any questions for the speaker, please type them into the Zoom chat area, and Dr. Anna will pose them to the speaker. Thank you.
Thank you, Tom, for the warm welcome. You can hear me? And good morning and good afternoon and good evening to everyone else from all over the world. Just share my slide. Okay, my presentation today is focused on my personal experience, sharing from the start of the pandemic, my observation and personal opinion in clinical, medical, therapist point of view, and as well as a trauma and emergency physician. It's somewhat a post-mortem of triggering factors that lead to stress and burning out of frontliners in the hospital setup, primarily in the place I work in, the emergency department. I can't seem to go to the next page. Generally, in general terms, if you Google search frontliners, there's a long list of participants of frontliners involved. Besides medical, we have the police, the military, the armed forces, and civil defense, and a long list of essential services. And the COVID pandemic in Malaysia was first reported on the 25th of January last year. The information about the disease, the characteristics, and what was actually going around is not clear as well. Retrospectively, we all agree at that point of time, the impact was unimaginable. And look at the impact today. Was this thought of last January? At today's world statistics, coronavirus cases are at reaching 173 million with deaths of more than 3 million and seriously critically ill patients at 88,000. On the 25th January was the beginning in Malaysia, where work-related stresses affected me myself, because that was public holiday for Chinese New Year, and there was a long stretch of holiday, and I was on call during that several days. There were so many phone calls from the district health office and infection control team, all discussing on plans. Most importantly, KL International Airport referral, because Our hospital is the center of referral, as we say, nearest to the airport. This is my emergency department. It's a department, but there is multiple units that people play an important role in. There's approximately 220 staffs placed in quite a small department with limited space for the management of infectious disease. One isolation room without negative pressure. Space is limited for each zones of red, yellow, and green, as well as waiting areas. Over time, we needed to set up external tents and improvise to attend to the ever-growing pandemic disaster. The frontliners of emergency department per se involves the medical emergency command center, where they take the 999 calls. And then we have the pre-hospital care team, the triage team, treatment and observation zone, and essential services. And every emergency department somewhat functions similarly with several specialized units. And their work is interrelated and dependent on each other. And who are these essential service hospital workers? We have our attendants and ambulance drivers, medical assistants, as well as paramedics, nurses, and radiographers. And then not forgetting the laboratory technicians, security guards, and cleaners and laundry workers and dietitian. This is something that I'm mentioning in the hospital setup. At that point of time, we suddenly start to worry. Me being the emergency physician on call, I start to worry and I start to think how to protect them physically, emotionally, and mentally. As a supervisor, that is my ultimate question. Help was needed. Again, at that specific point of time, there was no reliable resources for this new kind of virus management. We just got to make do with our basic knowledge and experience and get the message across to every level of frontliners in the department. So back to basics, implementation of safety protocols. But is this enough? Like any other disasters, briefings were initiated. Middle-level managers played an important role in executing the plans and SOPs. But this was mainly physical protection of the healthcare workers. Again, at that point of time, there was no plans on protecting the emotional and mental well-being of frontliners. Let's do a postmortem emergency services. The function is 24 hours, unlike clinics. We attend to cases out of hospital as well as in hospital. And it's a variety of cases, multidisciplinary, extremes of severity, and involves all ages. This is the entrance to the emergency department, the triage center. The triage counter is where our frontliner has their first encounter with walk-in visits. At the start of the pandemic, upon the knowledge of the outbreak, public panic ensued. People started crowding. Officers were physically and mentally exhausted because they need to repeatedly explain to all patients, carefully filter unnecessary attendance. Without them, the ED would have been overcrowded unnecessarily. There was panic and fear, poor information, inadequate dissemination of information. Hotlines were busy, so they come to our emergency department. And some patients were very rude and nasty to our frontliners. In fact, VIPs, the VVIPs wanted special treatment, and that was, in fact, more severe pressure. Looking at the healthcare workers' mental stress, the reason identified as mental stress for medical frontliners in ED was not knowing your enemy, the disease per se, the extent of danger. Can we do anything about this within our capacity? Am I safe enough? and how to manage this surge capacity. So indirectly, some mental stress was buffered with briefing and sharing the knowledge with appropriate communication, CMEs and messages, and ensuring adequate preparation and training in relevant aspects in the management of the disease COVID per se. This was then monitored every shifts and audited periodically until everyone was comfortable. Yes, being comfortable was the key to alleviate the physical and mental stress. This is what we did. Train our healthcare workers on personal protective equipment so that they feel safe doing donning and doffing the right way. And then we also trained about patient transfer in isopods, which is a secured transfer mechanism to prevent ourselves to be exposed to the infection. And then the other mental stress would be someone who's really ill, the decision making to continue or not to continue a resuscitation. Then comes the physical stress. The physical stress is unimaginable. Sweat and heat in the personal protective equipment, swabbing or managing suspects of infection is not easy. And some staffs ended up in quarantine through community spread. Hence, remaining staffs had to work in double shifts, sometimes extended. Most of the time, working environment was not conducive, not forgetting the personal health conditions as well. We have staffs that have pregnancy, ongoing pregnancy, having diabetes, hypertension, obesity, and even heart diseases. We should remember they are also human, so they have everything a patient has. Healthcare worker physical stress. Well, lacking of sleep is so very common. Exhaustion, fatigue, falling sick, and family responsibilities. They have their own personal obligations as a mother, as a father, wife, husband, son, or even a daughter. Being exhausted from work and back home with responsibilities. I would like to share with you a publication addressing the mental health of healthcare workers during the pandemic in June 2020. There are many identifiable key factors that is related to the extent of the mental health problems faced by healthcare workers. And this study in Italy confirmed a substantial proportion of mental health issues affecting particularly young women. Therefore, this study warrants further monitoring and specific interventions for healthcare workers throughout this pandemic to prevent long-term mental health-related disabilities. Sorry, somebody's screen has come into my... So, let me see, something's gone wrong here.
Hi, Dr. Sri Latha, everything okay?
Yeah, I think some of the screen is here.
Okay, let me take a look here. Could you disable your share, your screen share for a while and then rename?
Yeah. Okay. What should I do?
Reshare again, one more time. Reshare your PowerPoint again.
Okay, let me see.
Yeah.
Oh, I think it's closed.
Always a technical error. Yeah.
Let me just reopen it. Okay.
Yeah, no problem.
All right. Okay, are you able to see now?
Don't see anything from over
here.
Yeah.
Okay, I got it, I think.
Yeah, you got it.
Right?
Yes, he's got it.
Okay.
Yeah, perfect.
Okay. All right, so let me just play this.
Yeah, okay.
All right, okay. Sorry about that. Okay.
No worries.
So the key mental health outcomes in frontliners is post-traumatic stress symptoms, symptoms of depression, anxiety, insomnia, and stress. This was concluded from the earlier publications I mentioned. And casually, I do always ask my frontliners, what is that you're really afraid? And the word itself explains intense fear, fear of making decisions, of resuscitation, when to call it quits, fear of making wrong decisions, fear of getting infected, and fear of getting back home and infecting their loved ones. And lack of personal protective equipment was the biggest problem. At some point, we were running out of the protective gears, and that was one of the things that is so important, and we had to do it ourselves and get donations and all. But imagine if we run out of it. So how can we prevent stress and burnout in frontliners? In my hospital, the mental health issue was addressed only this year. So we received a WhatsApp message requesting to refer anyone in need of support in Putrajaya Hospital. That was exactly on 22nd of January by the Department of Psychiatry, Mental Health, Psychology Counseling Unit, and Psychology Support. But how early or how late were we in implementing early identification of the whole pandemic impact on the psycho-mental well-being of healthcare workers? If we could, we should have identified early of all the symptoms and signs of insomnia, anxiety, depression, eating disorders, smoking, relationship problems, stress-induced complication, and post-traumatic stress disorder. And we should treat early, because if we do identify early, then we could have treated early and addressed these problems faced by frontliners. The number of stress and burnout victims can be minimized. As therapists, we all know that not all such conditions are labeled as psychiatric illnesses. Medication is not always the answer. Hypnotherapy can help manage stress, fear, anxiety, insomnia, mild to moderate depression, adjustment disorders, and PTSD. Hypnotherapy approach itself builds a good rapport between your supervisor and your workers that will help with a better working attitude afterwards. Hence, I do strongly recommend that preventive measures should be implemented early. Create a psychosocial and mental health care unit in each and every department. Administrators or superiors or unit heads should undergo training, create awareness on assessment, periodic monitoring and managing of all level of staffs, like your PHQ-9 test or perceived stress scale. Everyone should be trained in soft skills, which is emphasized in hypnotherapy training. Train in clinical hypnotherapy, in fact, solution-focused therapy, and even EMDR. I would like to share my personal experience in using EMDR in the ED. As clinicians, we know the relation of stress and inflammation. I did mention about stress and its complication in my early on slide. The root of various health ailments, either acute and chronic, is because of stress and inflammation. And some inflammation do cause pain, like your gout and rheumatoid arthritis and even migrainous headache. And all you need to do is improvise this therapy protocol, as it's not an ideal place to practice a lengthy treatment protocol in a noisy ED environment. So I did get a successful feedback from my healthcare workers who had acute gouty arthritis and toothache during this stressful period. And lastly, I would like to share an emergency medicine mindset by the clinical professor, Dr. Joe Lex. Hello, stranger, I am Dr. Joe Lex. I will spend as much time as it takes to determine whether you are trying to die on me and whether I should admit you to the hospital so you can try to die on one of my colleagues. You and I have never met before today. You must trust me with your life and secrets. I must trust the answers you give me are honest. After today, we will probably never see one another again. This may turn out to be one of the worst days of your life. For me, it's another work day. I may forget you minutes after you leave the department, but you will probably remember me for many months or years, possibly even for the rest of your life. Each question I ask you is conscious decision on my part, but in an average 8-hour shift, I will make somewhere near 10,000 conscious and subconscious decisions. So even if I screw up just 0.1% of these decisions, I will make about 10 mistakes today. With this, I thank you until we meet again. Is there any questions?
Thank you, Datin Dr. Sri Latha. Good to see you again. And I must agree with our participants who said that this has been a very emotional sharing as well, because you're giving us an insight into what happens at ED, and we can only imagine how bad it gets. And thank you so much, because I think you all are doing a great job. I think we've got a question here asking whether the healthcare workers are open to alternative therapies, and if they are, what is the platform? Is free therapy available for them?
So like Mr. Tom introduced regarding my therapy sessions, I used to do this as a favor whenever time permits. As you know, emergency department is a very noisy situation, but I do get to see them face to face with the mask on. But online platform is available, so this therapy is available, and I believe some of my colleagues who are attending this conference are doing free therapies for frontliners. So far, I have been not charging them.
How can, if you have volunteers, how do volunteers get in touch, or how do they sort of help you with this?
If we have volunteers, okay. Now, in Malaysia, hypnotherapy has not been registered officially for alternative treatment. So I think you understand about the issues faced in Malaysia. Yeah. So I also had trouble to actually openly practice hypnotherapy in Malaysia, because in our local community, they are quite afraid of the word hypnotherapy. They think of some other modality, so it's like black magic or something like that. So it is quite difficult. So it depends on how the frontliners mentality is. So we need to create awareness. So because it's not officially accepted in the Ministry of Health, what we can do is only penetrate within our colleagues.
Your circle, yes.
Yeah.
I think we've got one more question here asking how to deal with, because as you said, as you rightly mentioned, it's within your circle. But you find it like, any challenges having this hypnotherapy with your own colleagues, because I think sometimes we prefer to see a third party, but with the limitations, you're practicing with your colleagues. So there's a question on how do you deal with that?
Okay, one is to build rapport, but I have never had that problem of them feeling uncomfortable. They do come and ask me several times, and it takes some time for them to decide and get ready for therapy. So that is not a problem. And at the same time, if they do feel like seeing somebody else, again, we have our close community of therapists that we can refer each other, and that's how we do and go about it.
Thank you so much for your sharing, Dr. Latha. And so I will pass it back to Tom.
Thank you.